Hello, dear friends. Professor Moussa, thanks again for this invitation. And thanks again for proposing me this title, which Psychiatry for Children and Adolescents of the 21st Century, which is obvious our biggest challenge. And I propose to extend a little bit the topic of this presentation, not only to psychiatry, but to mental health, because most often we use these two concepts, and it is not clear often what does rely to mental health, what does rely to psychiatry. In our mind, most often this is the same thing, but you know something which is very important is that the mind of politicians, this is not the same thing, because the money does not come from the same place. The money for medicine comes most often from health insurance, and the money for mental health comes from policy in general. And so we have to be very careful about the words and about what we are speaking. So, first, I have no conflict of interest for this talk. And I propose to come back to the main object of our job, which are kids. At the very beginning of a kid, there is pregnancy. And you know that there can be some problem during pregnancy, and this problem can lead to mental disorder. You have also parenting. And also parenting is a very important issue in all countries on the planet. And there are a lot of evidence-based studies which shows that parenting support can increase mental health and even can help for mental disorder. You have school, because kids, when they are 6 or above in most countries, they spend around 6 hours by day in a school. This is so important that teachers have a very important role in their development. And of course, there is also the whole society, and here the problem becomes much more complex, because what is a society? First, a society is a culture. You live here in a country where there is a very long history. And when you live in a country where there is a so long history, these are roots for your development. And you have to take into account these roots, because they are part of what you are. And there are too few research at the moment on the impact of culture and history on psychopathology. And I have an explanation for this. Do you know which country produces the most important number of research in child and adolescent psychiatry? United States. They do the greatest job in research in child and adolescent psychiatry. And as you know, United States have a very short history. And so for them, history is not necessarily a main issue, because for them this is complex. And so, by this way, we lack the question of the impact of culture on development, and even of religion, which is a taboo in many countries. You cannot consider religious issue and psychopathology, even if we know that religion can be a protective factor of many mental disorder. You know, this is the case for suicide and for addiction. Religion can have side effects also. And unfortunately, we know at the moment that religion can have side effects on the development of kids. But religion has an effect, and as professionals, we have to take this into account. Stigma. Stigma is a very important issue. You know, when you are black, in many countries, if you are a kid with a black skin, you will be put apart. Color hair. In my country, when you have a red hair and you are a kid, you are put apart by other kids. And even in France, this is much important than when you have a black skin. Having red hair is a real problem. There are suicide attempts of kids with red hair because there is bullying about that. If you are fat, most often people laugh about you, etc., etc. And of course, life events, you know, unfortunately, in some countries there is war. And war is a so important risk factor for mental disorder. And in addition to work, you have violence in general and physical or sexual abuse, which are real problems in nearly all situations. We should add also genes. I put genes into quote because this is a real mess today. You know, we are so clever in biology that everything comes so complex. You have genetics, epigenetics, genomics, proteomics, etc., DNA methylation. Well, anyway, I will just say that this is biology, physiology, and of course a kid is a mind, but it is also a body, and the development of the body involves some very sophisticated things that interact with everything else that is called the environment. And so, indeed, you have relationship between all those things, you know. Culture influence parenting, culture and religion influence school and parenting. Society is related with stigma. Culture is related to stigma. For instance, many religions have problems with sexual orientation. You know, being homosexual is often a problem in many countries and with many religions. And so, this is one other parameter. And life events, of course, can be related to parenting because, unfortunately, most physical and sexual abuse supported by kids come from their parents. So we have here a big mess, which is a reality with which we are facing every day. And unfortunately, doing research with that is extremely difficult. Why? Because you cannot use a unique theoretical framework to study that. Biology explains one part, but you have also to use sociology, psychology, anthropology. And this is the reason why when you are a child and adolescent psychiatrist, the key word is culture. You have to read books in many, many disciplines to know what happens where you live, to know what is a body, a brain. You have to study neuroscience, anthropology, sociology, psychology, psychoanalysis. This is a little taboo also to say the word psychoanalysis in many congresses in child and adolescent psychiatry. This is crazy. You know, there are very good things in psychoanalysis to understand what happens with patients. Anyway, this big mess makes what is called development. That is, when you take a pregnancy, a newborn, he or she will grow. And according to all this interaction, the development will be fine or not. And there will be good or bad mental health. Do you know what is the definition of mental health? I'm sure you know the definition of health. You know the W definition of health, which is well-being, social, psychological, physical, etc. Curiously, the definition of health came very early, just after the Second World War, during the 1946. Mental health arrived in WHO much later, around 2001, and the definition of mental health is well-being also, with self-actualization and productivity, which is curious. But, you know, curiously, in fact, when you look at closely, the definition of mental health is very close to the definition of health, which raises some kind of philosophical issue. You know? I think this comes from the fact that mental health comes from the split that comes from the very beginning of the Occidental philosophy, the dualistic point of view that there is mind on one side and body on the other side, and this is the reason why we call health and mental health. Well, even if in reality, both are very close. Anyway, we are psychiatrists or psychologists. We have to deal with mental health. Mental health is related to well-being, and well-being comes when development is fine. Okay, so now, what about psychiatry? Psychiatry is a very different topic. You know, first there is a context about psychiatry. psychiatry is within medicine, and this is true in all countries on the planet. Psychiatry is a part of medicine. You have doctors in psychiatry, and also all over the planet psychiatrists are doctors. Second, you have institutions, and this is not a detail. Sometimes physicians are alone. Perhaps you are a child and adolescent psychiatrist with a private practice, and if it is the case, you are quite alone in front of your patient. You know, on the left, you have a global society. When you have a private practice by your own, you are completely alone in front of parents and patients and teachers, etc. And there is also the hospital. And hospital, it is a team. There are some private hospital, public hospital, and here is the beginning of something which is important, money, but we will come to that after. In hospital, we work as a team. And you know that this kind of work is very important. We have to collaborate. But something which is, we are a little bit embarrassed to say it, within this team there is a hierarchy. You know, hospital is not a democracy. This is reality. And this is because you have to be efficient in a hospital. In an intensive care unit, it cannot be a democracy, because if there is a debate, everything, when you have to say, well, do we do shock? Do we put glucose or sodium, etc.? We vote and the patient is died. So you have to act immediately, and so there is a boss, and there is people under the boss, and people under the people under the boss, and when one say, I propose that, the boss say, no, just shock. He is the boss, this is the decision. And this is how medicine works. And so within the hospital, there is a hierarchy, and this raises some problem in psychiatric departments. You have sometimes tensions between psychiatrists, psychologists, social workers, etc. Who is the right decision? We will come back to that later. There is also research. What is the theory of behind medicine nowadays? Biology. Biology. In France, I have estimated that a student in medicine follows about 600 hours of course in biology, physiology, biochemistry, biophysics, 600 hours of course in that. And do you know how many hours of psychology? Between 5 and 20. This is a shame. But in many countries, this is exactly the same thing. Courses in medicine are based on biology, even if you become a psychiatrist. And that's life. That's life. This is reality. Science behind psychiatry nowadays is biology and thus neuroscience. And it can be good in a way, because we have a brain. Our patients sometimes have epilepsy, etc. And so we have to deal with the brain also when we are psychiatrists. Unfortunately, as I said before, we should learn also anthropology, sociology, etc., and we should do research in this area. But at the moment, unfortunately, it is difficult to do this research, it is difficult to have them published. And at last, there is a question of money. As I told you, money within medicine comes from health insurance. And here it can change a lot from country to country. In some countries, health insurance is completely public, and in some other countries it is completely private. And so the way patients are treated will change completely according to the nature of health insurance. And of course, for the question of treated kids, who most often in our specialty comes from people with a low or middle socio-economical status, this is the real problem. So this is psychiatry, and you obviously you can realize that what is on the right part of this picture is not the same as with what is on the left part of the picture. So what is the relationship between mental health and psychiatry? In fact, it happens, and you have noticed that when a kid develops, most often kids develop quite well. In a huge majority, kids are fine in all countries. We often say that our adolescents suffer a lot and kids suffer a lot because of our societies, because of internet, because of everything. This is not true. When you look at statistics, most of kids and adolescents are fine. They are fine, most of them. But, of course, some of them are not so fine. Because their parents divorce, because there is a war, because they have problems, because everything. But this is not necessarily a medical question. This is not because you have problem in your life that you are going to go to the psychiatrist. Of course. You can be not always fine in your life. This is life also. So what happens? From time to time there is a rupture. This is not only that life is not so good. This is that suddenly within yourself you feel that things are completely different. You experience huge difficulty to life. And sometimes it comes from within you, and sometimes in psychiatry it is people outside you who consider that you have changed, this is not possible, you are different, you have a problem. For instance, if you experience a severe depression patients are here completely stuck, painful, and say, I don't understand what happens to me. This is us. I have a huge grief, but everything is fine in my life. This is unbelievable. This is rupture in existence without any reason. And in ADHD, it will be completely different. A severe form of ADHD, the patient most often is fine, at the very beginning. When I receive patients with ADHD, and even all patients, I ask them first in the consultation, why do you come to see me? And most often the kids say, I don't know. The parents are surprised because they have discussed all together about the problem, but within the patient, he doesn't know why there is a problem. This is the society, the teacher who say to the parents, for instance, it is 20 years that I am a teacher. I know kids, and this one, your son, this is unbelievable. This is so different. There is a rupture. Either a phenomenological, that is the way you live yourself within yourself, and a sociological rupture, that is how people see you. And when there is this rupture, you belong to the field of psychiatry. This is the definition of our job. Okay. We could ask at the moment, this is perhaps also a specificity of medicine and psychiatry, the role of biology in psychiatry as regards the role of biology in mental health. And this is an open question. Do you think that biology, genes, have a more important about development and well-being, or a more important role in mental disorder? My guess is that genes and biology has a more important role in the development of mental disease or disorder. But this is an open question, and this is a very interesting question, and perhaps the answer will depend on the disease. Anyway, what we can experience today, this is the Egyptian Association of Child and Adolescent Psychiatry. So you are the association of the left side, but of course you cannot deal without the left side of the picture, because once your kid is out of hospital, he will enter the family, enter the school, enter the society with religion, etc. And you have to prepare the kids to be within society. And so you will have to contact the teacher to deal with the parents, to improve parenting, etc., etc. And this is why psychiatrists have also to deal with something like mental health. And once you have prepared the way the kid will be in society, development will be better. And so the link with psychiatry will be less strong. And you have here a wheel which turns psychiatry, society, development, etc. It turns, and at a given moment, perhaps the arrow between development and psychiatry will disappear because the kid will be fine. This is what we call recovery. And another time, because of development, there will be a plateau because the kid is now an old adolescent, 18, 19, 20, and it is time, if he has still or she has still some problem, to go in adult psychiatry. And this is called transition, which is also a question that we have to face at the moment. So I come back to the topic of my talk. Which psychiatry for child and adolescent of the 21st century? First, we have to consider the left part, that is, what is strictly outside psychiatry. Outside psychiatry, obviously, the most efficient is to deal with life events. You know that the most important evitable risk factor of mental disorder are trauma, early trauma. And war, physical abuse, violence have to be prevented. And we have, of course, we cannot evitate war, unfortunately. But we have to say to politicians that when they engage in a certain direction where there is violence, they take the responsibility for the next generation to have huge problems. And this is our duty to do something like that, because this is reality. Second, we have to deal with parents. And we have to develop parenting support adapted to the culture in the country where you live. And we have to deal with teachers also, particularly with teachers, because, of course, teachers are trained. You can discuss with teachers because they have studied, they have been in the university, most of them. And so you can explain to them the problem behind the patient. 20 years ago, there was a split between school and psychiatry. Nowadays, in most countries, things comes better and better. Today, in fact, if we consider the left part of the picture, we have to deal with the society of a whole. As it has been said during the talk early this morning, our societies are experiencing huge change at the moment. Everybody knows that, but we do not realize to what extent these changes are so important. During the whole history of humanity, things have not changed like that. Why? Because on one side, you have societies with very old culture that structure them. On the other side, you have an opening, thanks to the internet, an opening to all the other culture of the planet. And so the youth, who are the most open to the internet, the youth are stuck on one side by their own culture, on the other side by what they see everywhere else on the planet. And this raises extreme tension between the youth and their parents, grandparents, and old people who cannot change as kids can change. And because of this, there are tensions between young people and their societies in most countries. About religion, about sex, you know, pornography is everywhere on the internet, and of course it raises issues in most countries, etc. The relationship between parents, the question of authority become a crucial question in many countries. How to have an authority with kids within a family. And nobody has any answer about all these questions because it appears suddenly. 20 years ago, this was not a problem. Today, these are problems. And we have no solution, and we have to help societies to find solutions about that. There is also within psychiatry. We have to answer, if we want to improve psychiatry in the 21st century, who should be treated? I'm sure that if I ask you the question, who should be treated? You will answer me, we should treat patients. We should treat kids with mental disorders. Okay, but look at the NCS study, the best epidemiological study done on adolescents, which has been done by American people. They find that about 50% of adolescents will have a clinical relevant mental disorder during their adolescence. 50%. I have estimated that if these figures are true in France, all psychotherapists should deal only with adolescents to be able to treat these 50% of adolescents. This is crazy. This is not sustainable. This is crazy to say on one side there are plenty of patients and on the other side there are very few clinicians. If you say that to politicians, they look at you and they say, so the situation is so desperate that we cannot do anything, so bye-bye. We cannot say that we should treat everybody. This is not reasonable because this is not possible. And this is in particular true about screening. You know that early intervention are the most efficient intervention. So screening is something very important, but if you screen and if you cannot treat all the subjects that you have screened, this will be a disaster. So we have to be courageous and we have to answer to the question, who should be treated? Second, we have to use evidence-based treatment, evidence-based practice. Nowadays, this is something which is accepted by everybody, even psychoanalysts. But what we do not say is that at the moment, most of evidence-based practice are not sustainable, even in highly developed countries. You know, what is the standard of the treatment of ADHD? Medication, when it is a severe form of ADHD, okay, and also psychological treatment. Who can sustain, which country can support the cost of psychological treatment for the supposed 5% of kids who have ADHD? This is not possible. This is not possible. Perhaps in Switzerland or around the region of Boston, where there is the highest number of psychiatrists in the world, among them Esham. Perhaps in very specialized, in very specific part of the planet it is possible. Outside it is not possible. So we have to develop evidence-based treatment that are sustainable, that can be proposed in real life, and that are transposable, because most of these treatments have been developed and studied in very particular part of the planet, most often in Occidental countries. And it is not sure at all that these treatments that are evidence-based in this country will have the same interest in your country. We have to learn how to work together. We have to learn how to work together within our team and with adult psychiatrists, because many of our diseases are chronic diseases. And so our patient one day will come in adult psychiatry, and we are not good at all at the moment in this transition between child and adolescent psychiatry and adult psychiatry. And adult psychiatrists are also responsible of that, of course. And there is the question of money. Money in our societies should be allocated according to needs and not according to fantasies. In my country, money go mainly for HIV, cancer and Alzheimer's disease. Why? Because HIV, they do a lot of advertising on the TV. And cancer and Alzheimer's disease because politicians are afraid by Alzheimer's and cancer. And because child and adolescent psychiatry is not considered that much, We have fewer money than other diseases. This is not fair. This is not fair. And here is a picture that you can show to your politician. This has been done by WHO. According to medical disciplines, what are in most continents, what are the medical specialties that are the disease that have the highest impact on years of life with disability for kids between 5 and 14. And you see that in most continents, mental disorder appear in the second position. Very close to the first one, which is nutritional problem. And then I said before, it is very likely that in 10 or 20 years, the black bar will become the highest bar. And this is epidemiological reality, and we have to say that to our politicians. Now, things will not be so easy to improve the psychiatry of the 21st century. We will find obstacles on our way. What are these obstacles? We have to know them to be stronger than them. The first one is the curse of care. The second one is ambivalence toward kids. And the third one is anti-psychiatry. I come into details. What is curse of care? Curse of care is that in most countries, not all of them, but in most countries, taking care of people is considered as something not professional. Most often this is considered as something for women, and this is considered as something that should be free. You know, this is just because we love people, that we take care of them, and that's all. So money is not a problem. This is not a question. This is only a question of we have to do things, and in practice, this is to women to do these things. And of course, child and adolescent psychiatry rely a lot on care. For instance, what are the most efficient treatment in child and adolescent psychiatry? Non-pharmacological treatment. And non-pharmacological treatment are a kind of care, technical, very sophisticated care, but it is some form of care. And so, as I told you, many people consider that, well, psychological treatment, this is only a way to speak to people. If they speak, this has no value, you know. They just give advice. And we have not to give money to advice. We have to give money to brain imaging, to antibiotics, to drugs, not to speech. In some regions, politicians consider that psychiatry is a fantasy, that religion or family should take and should deal with mental disorder. I have been in Gaza trip 4 years ago because the Hamas decided that MSF, Physicians Without Borders, should not propose anymore psychotherapies for kids with PTSD. And we had to go and to see the Vice Minister of Religion to explain that, of course, religion can help, of course, family are important, but evidence-based treatment are more than religion and family. And we did it all together. And also, most of our country are fascinated by high-tech treatment, you know. Brain imaging is fascinating. You see what is inside the brain. And so many people put money in brain imaging, even if in child and adolescent psychiatry, this is not so efficient to do brain imaging. Ambivalence. This is something that you know, but that very few people know. We are supposed to love kids. Everybody says that everybody loves kids. But once you are on an airplane and there is a baby just close to you, nobody loves kids anymore because kids cry, they give headache, and you know, in fact, that all mothers at a given moment will hate their kids. You know that. This is Winnicott, hate in countertransference. And this explains why there is physical abuse within families, why this is so frequent. Because we love kids, indeed, but sometimes we hate them also, whether they are kids or adolescents. And this is the same for politicians. So when we say to politicians, These are our kids, this is our future generation. They say, oh yeah. But I don't. They make noise. We will see. And of course, child and adolescent psychiatric patients do not raise empathy. You know, when you have a kid with leukemia, everybody cries. When you have a girl with anorexia nervosa, this is disgusting. Nobody wants to see her. Even if the prognosis of anorexia nervosa is the same as the prognosis of Hodgkin disease, which is a leukemia. This is the same prognosis. These are two diseases, very severe disease, but one, nobody wants to see it. Anti-psychiatry, unfortunately, as I told you, many people consider that ADHD is an invention, that depression do not exist in kids, that psychiatric disorders are just bad luck, that you cannot treat psychiatric disorders, they just go with life, and so you have not to spend money with that, etc., etc. So now, what can we do about this? Of course, we have to do science, and this is the reason we have to do research. When people say that we are doing just care, we have to show with randomized control trial that what we do is efficient. This is evidence-based. This is efficient like medication, and sometimes more than the medication. Today, you are serious when you are doing clinical research. So if we want to appear serious, we have to do clinical research. To struggle about the ambivalence of our kids, you have to use good arguments. As I told you, between anorexia nervosa and Hodgkin disease. When I say that to politicians, they are saying, I didn't know that. Yes, this is reality. You can use economic data. As it has been said, it costs a lot not to treat young patients. Child and adolescent psychiatry is very, very cost effective, and there are beginning of data about that. And about the anti-psychiatric movement, neuroscience are of a big help. Why? Because nowadays you can show with image that mental disorder or mental disease are not only a fantasy, because we can see them. And this is likely to be the most important impact of neuroscience. You can touch mental disorders with neuroscience. What can we do also? We have to open the question of our role. Within psychiatry, we have to determine what is the real role of a psychiatrist. And this is not an easy question. You know? And I'm sure that the answer to this question will depend on the country. This is the reason in Egypt you have to deal yourself with this question. In some countries, it appears that psychiatrists will only deal with prescription of medication in some countries. In some other countries, they are the chief. They organize all the treatments. And most often they do not have that much contact with the kids because there are too few psychiatrists. In India, for more than 1 billion of inhabitants, there are only 60 child and adolescent psychiatrists. So their role will obviously very different than the role of Esham, who lives in Boston. And of course, there are so much more child and adolescent psychiatrists. Within societies, we have also to determine what will be our role. Because on one side, we have things to do, prevention, interaction with school, with education. On the other side, we have to be very careful in our interaction with society. Because we have a legitimacy within hospital. Within hospital, we can say, if this treatment is better than this treatment. This is our job. But within society, we have not the same authority. We have not the authority to determine how kids should be happy. Sometimes psychiatrists think that. Sometimes some of our colleagues consider that they know how kids should be to be happy. This is not our job. Our job is to treat with pain, with sufferance, with disease. Our job is not to make kids happy. This is the role of a society. Sometimes we overuse diagnoses, you know. When I heard that 10% of kids have ADHD, you know, perhaps this is academic, this is true on an academic point of view, but this is crazy. You cannot say to people that everybody has a mental disorder, because people don't believe you. People are afraid that psychiatrists would like to treat everybody on the planet, you know, with pain, with medication, and medication could be everywhere. Many people are afraid of that, and so we have to be cautious about what we define as a disease. And this is the reason why many people are afraid of psychiatry. They consider they are dangerous. And so this is my last slide. This is my conclusion. Nowadays, society are experiencing colossal tensions. And so societies have no choice. They have to adapt themselves and to evolve, because if this will not be the case, there will be revolution. So this is the main issue, and as citizens, not as physicians, as citizens, we have to help societies to evolve. On the other way, psychiatry does exist as a medical specialty, and psychiatry is likely to become the most important medical specialty of the 21st century, because there are many kids in our societies, and mental disorders are going to be the main disorders. So we have a huge responsibility, and we have to answer to the question, who should be treated? This is a very important point. We have to find sustainable and transposable treatment. You have to think to your culture, and you have to read papers coming from other culture. We have to think about task shifting. What should we do in our clinic, and what shall other professions do? And of course, we need money, and we have to promote advocacy in favor of our specialty, and we have to work together between national organization and YACAPAP. We love to help you in this direction. Thank you for your attention.